pain. Now, what are the most common causes of nerve pain or the common causes of nerve pain that every executive mom should know? And we're going to discuss some tips after that to prevent or manage nerve pain. Now, as an executive mom demanding, juggling a demanding job and family responsibilities, you've likely experienced those moments where your body seems to be um, it seems to just not cope up with all these everyday juggling activities, as I said, between your work and your family life. And perhaps you felt that burning, tingling, numbness kind of a sensation in your back or your neck, or even in your limbs, like your arms or your legs or your bottom area. And that just refuses to go away. Now, this could be a nerve pain. Of course, there can be many reasons for that, but one of the possible causes is a nerve pain, a condition that can really disrupt your everyday life and makes it harder for you to stay focused and productive. So let's understand some of the most common causes for this nerve pain, and really that is the first step to managing it effectively. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their back, neck, and nerve pain despite low energy levels and brain fog. By brain fog, I mean lack of focus. Now, I do so by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain and adrenal fatigue journey. Now, adrenal fatigue is a very broad term. However, the two main symptoms I had were lack of focus, that is brain fog, and low energy levels. And really, it is very, very difficult to manage or prevent spinal and nerve pain when you have low energy levels and lack of focus, especially low energy levels. All right. Sorry. So moving on, what exactly is a nerve pain? Now, for those who don't know about it, nerve pain, also sometimes known as neuropathic pain, occurs when there's some kind of irritation or compression or probably even damage to the nerves in your body. Now, usually irritation or compression is the reason. Now, um, it may feel like, I mean, it's unlike a muscle or a joint pain. It can manifest in many different ways. It could feel like burning, tingling, numbness, sharp shooting pain, a dull, achy pain, or just a discomfort in the area. Now, it can also manifest as sensitivity to touch as well, actually. Now, when you are constantly on the move because of your job, because of your kids, family, etc., nerve pain can be a major, major obstacle. I've been there, done that. It can affect everything from your work efficiency to your energy levels or fatigue as well. Now, if you want to know more about nerve pain and why is it so, the symptoms so variable, why isn't just pain? Why is it so many different symptoms? And for example, if I have, say, sciatica, that's a kind of nerve pain. And my symptoms, the reason for yours and my sciatica may be the same, but your symptoms may be very different from my symptoms. Now, why does that happen? All this I have covered in different videos that are present, that are available on my YouTube channel. You can have a look there. So you can go to YouTube, type my name, Swati Prakash Nerve Pain, and those videos will come up for you, or you can just look on my channel. All right, so moving on, let's discuss the most common causes for your nerve pain. Now, of course, as I said, it could be due to nerve compression or irritation, and it is also known as a pinched nerve. And when that happens, it could be due to the surrounding structures, that is your muscle, your spine, the bones in the spine, the ligaments, anything that basically exert that compression or they irritate the nerve. The nerve is rubbing against these structures. Now, common conditions that can lead to nerve pain can be your herniated disc, or in common language, it's also known as a slip disc. So the discs in your spine, they act like a cushion between the vertebrae, right? So you have your vertebrae that build up the spine. In between every two vertebrae, there's a disc. So when one of these discs moves out of its place, so I'm not saying like completely displaces out, but even if it's sort of bulging out of its place, or it's at the other end where it's totally ruptured and totally out of its place, of course, that needs surgery. It can present as it can exert pressure on the nearby nerve and causing nerve pain. And if suppose it's in your neck, the nerves in the neck go and supply your arms, forearm, hands, and fingers. That is the area the nerve pain will manifest. Or say if you're looking at very specific nerves, suppose I have a nerve pain in my upper part of my neck, that is upper cervical spine, might manifest as a headache that goes along the back of the head and basically in the distribution of those upper cervical nerves, or it can manifest as nausea, headache, even vomiting. So those are your upper to mid cervical nerves. And if say it is say C5, 6, so fifth or sixth vertebra around that area, it can manifest as a lot of nerve pain around your shoulder. So the nerve is being irritated in the neck, but it is manifesting in the area where the nerve is supplying. So similarly, for your lumbar spine, that pain might be in your legs or bottom or down even into your toes, because that's where those lumbar nerves will supply. Anyway, moving on. Spinal stenosis, where this is another condition that involves narrowing of your spinal canal, which can compress nerves in the back and neck, actually anywhere in the spine where it is present. A poor posture, that is another one. So, as an executive mom, you may spend very long hours sitting at your desk, or for that matter, if you have a standing desk, standing at your desk, or in meetings or traveling. And you may do this for a stretch of time without breaks in between. Now, poor posture on top of that, if you are sitting for prolonged periods of time or standing for prolonged periods of time, on top of that, you have a poor posture, you're slouching or you're craning your neck forwards like this, which is known as a forward head posture. It can contribute to nerve compression, especially if you have a forward head posture, it'll be your neck and your upper back that will bear the brunt of it. So poor postures can also cause nerve compression. It doesn't have to be a disc or a stenosis or arthritis or degeneration in the spine. If for that matter, even repetitive strain injuries. So if you are repeatedly doing something like carrying a very heavy bag, or you are not sitting properly at your desk, or you're doing some repetitive movement, for example, if suppose you are repeatedly bending over, your work involves lifting and carrying, so or you're a mom and you've got a little toddler and you're repeatedly bending over, picking up toys, bending over, doing the diaper changes. So you're doing those repetitive movements day in and day out that can irritate the nerve over time, leading to pain. Of course, if it's done in a good posture, that's different. But what can you do about this? Now, of course, you can improve your posture. And there's lots of videos that I've done on posture. And we are not talking only about sitting posture, though that's majority of the time in your day. It's also about your standing posture, about your sleeping posture. So have a look at those videos on the YouTube channel, if you're on my YouTube channel, if you want to. Also, I have written a blog on the same topic about nerve compression. Nerve pain, the most common causes of nerve pain. I will leave a link to that blog that I have written on this topic in the description of this video. If you're watching me on Instagram, the link is in my bio. If you're watching in real time, it'll be one of the top few blogs there. If not, just send me a message and I'll send it across to you. So in your message, just mention the topic for today, which is most common causes for nerve pain, and I will know which one and I'll send it across to you. That blog also has a video on what is nerve pain. So that's a simplified, really simple, not sciencey language, a simplified explanation of what nerve pain is. And it gives you more on posture as well. And yes, moving on. So incorporate regular breaks to stretch and to walk, reducing that compression on your nerves. And if you have a disc issue, if you have a stenosis, whatever is the basic cause of your nerve compression or irritation that is leading to nerve pain, have that looked into, right? So apart from correcting your posture and introducing movement, you definitely want to treat the basic cause. All right, so understanding your nerve pain is quite essential, because once you address that and you make small adjustments in your daily routine, you can gain control of your comfort levels. So, and of course, you can make better decisions in regards to your health. Or when you meet your doctor or healthcare professionals, you can discuss it better with them. Now, if you are looking for some additional help on nerve pain, I have a quick guide about how to manage your nerve pain with some easy desk-based exercises. So basically, you're sitting at your desk and you're doing those nerve pain exercises. So if you are interested in that, again, I've left a link to that in the blog that I just mentioned in case you missed it. I will leave a link to that blog in the description of this video. And if you're on Instagram, you can message me common causes of nerve pain, or you can just have a look at the link in my bio and it'll be there. So yeah, that was all I had for you today. If you have any questions, any comments, do let me know and I'll be happy to address them for you. Alrighty, I'll see you guys next time. Bye for now.